Ian. Thanks very much.
Thank you very much, Alison. It's a pleasure to be here. Fortunately, the volcano allowed us to fly to London, but when I was flying here, some people on the same flight were going to Ireland and they got stuck. So let me start with an anecdote, which I think is quite telling. About 5 years ago, I was asked to contribute a chapter to a volume that the World Bank was going to edit on the lessons of the 2004 World, can't remember exact title, but it was the World Poverty Forum that took place in Shanghai, China. And they particularly asked me to write about lessons on evaluation. So the first thing I did together with my colleague was to go and look for the evaluations that for the about 100 or so cases, best practice cases that were presented during this event in Shanghai. And we established a very low benchmark. Okay, we're not, we're looking for attempts at just establishing some type of counterfactual, even sort of a very simple one. And what we found for these cases that were actually presented as best practice cases, and what we found was that about 15% of the cases that were presented at the conference had any kind of evaluation, and we included there also evaluations that were not ready, so actually that were in process. So in a sense, they were not, nobody knew whether they would be considered best practice or not. So writing that chapter, I found a quote from Primo Levi, which I think describes quite well the basic message of that chapter and a lot of the underpinning for the work that we've been trying to do over the last few years. And I'll read it quickly. He said, "Since it is difficult to distinguish the good from the bad prophet, we must be suspicious of all prophets. It is better to avoid revealed truths, even if we feel exalted by their simplicity and splendor, even if we find them comfortable because they come at no cost. It is better to be content with more modest and less inspiring truths that are laboriously conquered step by step with no shortcuts by studying, discussion, and reasoning, and then can be verified and demonstrated." And that's the spirit with which we have approached this agenda, with humility and a lot of respect for the level of ignorance that we often have about what works and what doesn't work. A few weeks ago, actually about a week ago, according to the date there, I asked someone in my office to run through, we have a database that is actually accessible to anyone from outside bank on all the ongoing impact evaluations that we're engaged with. And as you can see, there is, we define ongoing once the evaluation has gone beyond the design phase. So there is the under discussion are things that are being planned, but some of them will actually not materialize. As you can see, there is a more than decent number of evaluations that tell about something major happening over the last few years. The breakdown by sectors is also quite interesting. Still, the human development area in which I work continues being the most important one from a quantitative point of view. If we had done this a few years back, would have been 70 or 75% in the human development area. So there's been a movement over the last few years to go beyond that. But as you can see, it still represents the major chunk. There is a number of important themes, and I'll come back to this in a minute. But as you can see, social programs, conditional cash transfers are one of the most popular ones, but there is actually quite a bit of work going on in all of the, both in health, education, and social protection. And finally, while in terms of regional diversity, while 5 or 6 years ago, this was mostly something that was happening in a few Latin American countries. Today, as you can see, there is a wide number of countries and regions in which the impact evaluation work is ongoing, and a lot of the effort has been focused on getting work in low-income countries, particularly in Africa. Now, one approach that we have followed quite consistently is to try to define priority areas for our impact evaluation work. The idea is, first of all, you can't be evaluating everything under the sun. You need to be selective. There is a large cost involved in doing impact evaluations. And there's capacity limitations as well, both within the bank and most importantly at the country level. So we need to be selective. And in that sense, what we have tried to do is to focus on areas in which there is growing interest that are important for the policy-making process. But beyond the selectivity issue, from a learning point of view, we understand that you can't learn as much from a single evaluation as you can from a program of evaluations, whereby either similar interventions are being evaluated in different situations, or variations of interventions are being evaluated. And for that, you need some level of volume, some more programmatic approach. And these are the 7 areas, priority areas in which we've been working. Conditional cash transfers, pay for performance in health, school accountability or measures to increase accountability of schools, malaria control program, active labor market programs, prevention of HIV/AIDS, and early childhood development programs. If we had a whole week, I would like to spend several hours on each of these and go through what are the research questions, what are the results that we have, and what are the lessons that we've learned, both from a policy point of view and a methodological point of view. But we don't. So what I'll do is the slides focus on the first 3 topics, and the other 4 will have to wait for another occasion. But even in terms of the 3 topics, I probably won't have enough time to go in a lot of detail into each of the 3. You'll have the access to the presentation, and I'll be happy also to answer questions at the end of the presentation. So let me start with conditional cash transfers, which have become extremely popular in the developing world. This is a slide of about 1997, which in fact magnifies the importance of CCTs back then, because in fact in Brazil what you had was 2 cities, Campinas and Brasilia, that were experimenting with CCTs, and in Mexico the Progresa program was still in its pilot phase. And this is drawn from the book that Alison was mentioning, and we sent this map to the print shop. I guess it was October 2008. You can see how the growing number of countries in green, and actually soon after that, I was making presentations in various countries and got into trouble because some countries had already moved beyond the design phase into implementation phase, and they were complaining that they were not showing up on the map. So this is a growing trend, clearly. The interesting story is that starting with the Mexico program, there's been a tradition of building impact evaluations into the design of CCT programs. I don't miss an opportunity to mention that I believe the only CCT program that I'm aware of that has not been evaluated and consciously not evaluated is from my own country, Argentina. It's called the Familias program, and it's the one country that I'm aware, the one program that I'm aware has not been, no evaluation has been attempted. So when we wrote this book, we actually were lucky to be able to draw on evaluations from over a dozen countries. And we looked at what we call first-generation evaluation questions. What have been the impacts on consumption and poverty, on the utilization of health and education services, and whether there have been or what have been the impacts on final human development outcomes. I'll run quickly through this, and if there are questions I can answer later. In terms of impacts on consumption and poverty, indeed, CCT programs have been found to have significant positive impacts on consumption and on poverty. Here we have 4 countries for which the data is available, and different measures of poverty. This is as poverty reduction programs go, this is actually quite remarkable in terms of the size of the impact. We looked also, as you know, CCT programs have this double objective of reducing current poverty through the cash transfer, but at the same time seeking to reduce poverty in the long run by increasing the human capital of children. And they do so by getting more children into schools or more children to receive basic health services. So again, in terms of the impacts on school enrollment, there's quite a bit of consistent evidence that the CCTs have increased school enrollment. In some cases, the effects are remarkably large. The interesting point is that even small transfers seem to have a relatively, in some cases, seem to have a relatively large effect. Similarly, for health service utilization, what we're talking about here is well baby visits and very simple primary health care services. Once again, positive impacts almost across the board. Now, this is only half of the story. The reason why you're interested in getting children to go to school is so that they learn. And the reason why you want to get children to go to the health clinic is so that they get healthier. And so we also looked at what is the evidence on impacts on final outcomes. When it comes to learning outcomes, the interesting thing is that most of impact evaluations were not designed in order to measure impacts on learning outcomes. They are now, but the initial ones were not. And so it's not an easy question to answer. The bottom line is there is a couple of cases in which there is some credible evidence that we refer to in the book that actually shows that the increase in school enrollment did not manifest itself in an improved learning outcome. So in bottom line is more kids in school, but they're not learning. When it comes to health, the one way to measure health is through malnutrition, the incidence of malnutrition, and it indeed has there's been an improvement in some cases, but not in all of them. So there's in the book we discuss why increase in service utilization does not get translated into final outcomes. There is a number of reasons for that. Part of it may be low quality of the services themselves. There may be, in some cases, maybe too little too late in terms of, for example, getting a 12-year-old that has been out of school to actually perform and learn. So there's a number of hypotheses. Now, we're now focusing on what we call second-generation evaluation questions. And here I don't have results for you, next year, perhaps I'll come back and show you some results on this. But basically, what are the types of questions that are being asked right now? They're mostly design questions. The first generation evaluation questions answered in a quite conclusive manner that CCTs were in fact working, were having an impact. And now governments are asking, well, but how exactly does that impact happen? And these are policy design, program design questions. One of the questions is conditions. Do we need conditions in order to get the impact on service utilization, or would an unconditional cash transfer work equally well? We couldn't answer well that question when we discussed it at some length in the book using natural experiments of various sorts, but now there is several countries in which there are conditional and unconditional programs side by side, and evaluations are actually looking at this. Another point is these programs typically make the payments to the mothers. And we speculate that, based on evidence from other sources, that indeed that makes a big difference, particularly on the health side, because it's known that mothers spend differently than parents. So who controls the money makes a difference. But again, what we have is a set of countries in which this is being tested, including paying the children themselves. This is mostly for teenagers. And the final type of issue, policy design issue, has to do with the design of payments. How much do you pay? In how many installments? Does it make a difference? Here, there's a couple of cases with results already that look in some detail at the question of the design of payments. So, for example, there seems to be the evidence from Cambodia suggests that there's diminishing returns to payment levels when you look at them just in terms of educational outcomes, obviously not in terms of poverty. So this is the type of analysis or meta-analysis that we are trying to generate or make possible through these programs of impact evaluations. CCTs are the first area in which we're doing this, and the next one is on school accountability, and the book is going to be published hopefully before the end of the year. So perhaps again something for a topic for a presentation next year. So moving on, let me say a few things about health. And as you probably know, one of the most popular movements in development these days has been built around the whole issue of results-based financing or pay for performance. This is, again, like CCTs, a family of programs. These are not all the same, but essentially the notion is that rather than paying for inputs, according to the purchase of inputs, what the financier is doing is paying someone on the basis of results that are being achieved. And there's a variety here. This is about donors dispersing funds to governments. It's about central governments making conditional performance grants to local governments. It is about governments paying to providers, et cetera, et cetera. And again, a lot of interest. A lot of resources going into this kind of program. How much evidence is there about it? So the set of questions that people ask is a long set of questions, but essentially what we're interested in knowing is whether an introduction of pay for performance when it comes to patient services will have an impact on both the quality and the quantity of services provided, with the potential of a number of negative side effects that we're concerned about, equity and whether there's going to be just switching from one service to another, etc. So that map, we learned the software and how to draw maps, and so we use it now. And this map tells us the countries in which we're involved in doing this kind of evaluation. And this started a couple of years ago, and the first evaluation that we completed was for Rwanda. And so I'll just spend a couple of minutes showing you a few slides on Rwanda. This was a national pay-for-performance scheme focused on essentially provided bonus payments linked to the achievement of certain goals and results in maternal and child health care. There were essentially 14 types of outcome indicators, number of prenatal visits, and institutional deliveries, and some measures also of quality of the care provided. The paper is actually available on our website. It's been released just a few months ago. Here I have only 2 slides showing results. The first one is for institutional deliveries. And so what we have, this is a randomized controlled trial, and what we find is a 7.3% increase in the proportion of institutional deliveries associated with the use of performance bonuses. Similarly, we find also a quite significant impact on the quality of prenatal care. There's an interest. We're not yet at the point where we can have the kind of general conclusions that we derive for CCTs based on a couple of cases. There's actually another one which I'll skip. We'll just run through in a minute. But there is a number of lessons coming up from Rwanda that I think are interesting from a conceptual point of view. For example, we didn't find, the researchers didn't find an effect on the number of prenatal care visits or immunization rates. These are outcomes that are mostly under the control of families. And the incentive here, in this case, was an incentive to the providers. So this raises the question of whether the supply-side incentives need to be matched with demand-side incentives, a la CCT, in order to actually get the impact. And in some cases, actually, in some other countries, these programs are actually experimenting with supply and demand-side incentives side by side and designing the evaluation in a way to actually answer that question. So this is the type of design, probably second-generation design evaluation question that one would like to focus on. Let me keep moving. In the presentation, there's also the case, an older evaluation of a P4P in health in Uganda that had actually 3 arms. There was a performance bonus. There were other providers that were not given the performance bonus, but they were given flexibility in the use of the basic grant, and then there was a control group. And what they found in this one was that the performance bonus made no difference, while the freedom to allocate resources did have a positive impact in terms of outcomes. The authors speculate there's a number of hypotheses why this may have happened. Perhaps the amounts were not large enough of the bonus, perhaps the scheme was too complicated, or there was not enough time, et cetera, et cetera. So again, you cannot derive a conclusion from a single evaluation. You need to have programs of evaluations of the type that I mentioned in order to be able to answer the bigger policy questions. Moving on to school accountability. And I guess by now the development community recognizes that it's not enough just to get kids into school, particularly into schools that are so perform so badly that actually the kids do not learn. And there is a range of interventions that are being considered in order to increase learning outcomes. One of them is what we call accountability reforms, which tend to seek to change the environment under which school decisions are made. This comes from the accountability framework, or was inspired very much by accountability framework for the World Development Report 2004, the focus on the relationships between politicians, citizens, users, and providers. And in more concrete terms, the way we often see this is how we transform the sleeping teacher into a well-performing teacher. Probably shouldn't say which country is which. Again, there's evaluations going on and have been going on for a number of years in a range of countries, in looking at three types of interventions: school-based management, so the school, it's essentially school autonomy, provide the provision of information to users of services for accountability, and also a set of incentives to teachers in the way of how they're paid and how they're hired. So this is the parallel of the P4P in health. Let me run quickly through a few examples. How am I doing with 5 minutes? Okay. School-based management, here the idea is more autonomy for decision-making, particularly with the role for parents, can make a difference in terms of stronger incentives for performance. Again, there is evaluations in a number of countries. Here I just refer to one from Mexico, where grants were made to, plus training were given to parent associations. And this was in the context of a program that was focused on schools in indigenous areas of the country. So these were really households that were experiencing a number of forms of social exclusion, so very extremely poor and excluded families. The interventions started in 1997. What the evaluation shows is a reduction in the failure rates, a reduction in repetition rates, and actually no change in dropout rates. And the explanation for this is that this was on top of the conditional cash transfer program, and the evaluation was designed actually to measure the incremental effect of this program on top of the Oportunidades program. So all the effect was in reduction in dropouts was associated with the CCT program. So this is just one example of several. As I mentioned, all of this evidence is being put together now in a book that will review the evidence. Moving on, and this is an interesting one. Can we improve accountability by providing more information? This is quite appealing because actually information in the end is less expensive than many of the other interventions, right? And there's a number of hypotheses as to how that may operate. It can empower parents vis-a-vis service providers and local politicians. It can also enable better decision-making by the schools themselves. It can provide the underpinning for incentives of various sorts. When there is school choice, this can provide the basis for choice. So what are the examples I mentioned a few. Well, the best known by now, almost all cases, is the case of Uganda, where the original PETS study found huge levels of leakage that led to a public information campaign, which led to a reduction in the leakage that occurred. But there is a new set of evaluations that have focused more on the effects on learning outcomes. And I want to refer here to two evaluations, both in India, which have different results. And so India had gone for a number of years through a process of decentralization with the formation of village education committees. And there was quite a bit of evidence that actually there was lack of information. The village education committees did not know, or the villagers were not fully informed as to what their roles and functions were. And so here there is two programs that were seeking to provide information to villagers on their roles, as well as on the performance of their schools. One of the evaluations was linked to an intervention by Pratham. This was done by Abhijit Banerjee and a number of colleagues, including Stuti Kemani from the bank. The other one was done by with funding from the Nike Foundation, and this was done in 3 states in India. I don't have time to go through the individual evaluations, but the first one essentially found that the information campaigns per se had no effects on either on what the village education committees did or on the results in terms of learning outcomes. And the intervention, the third intervention that they tried, which was essentially training teaching volunteers, was the one that actually had an effect. So this is a case of an intervention, information intervention that failed, seen from this perspective. Interesting contrast is this other evaluation, which focused on 3 states and actually found quite positive results. Again, they're not positive across the board. In some cases, there was no impact. But the story seems to be quite different. That here, the intervention, providing information, does pay off. Now, what is behind it? Is it that the interventions are slightly different? Okay, you say, I need an information campaign. There's different types of information campaigns. Is it that this information campaign worked better than the other one? Is it that they operate in different areas? There's an overlap in one of the states, Uttar Pradesh, but not necessarily. It's a large state, as you know, so not necessarily in the same villages and districts. So again, another example of how we need to have programs of evaluation. Moving on, and getting closer to the end, the final set of evaluations that we're looking at have to do with pay incentives to teachers. And this is a problematic and complicated politically effort. But in fact, there are a number of countries that are experimenting with such approaches. And thought I had a map, but I don't. And in several cases, we are working with the governments that are experimenting with these approaches. And there's one interesting case from India, in Andhra Pradesh, where they experimented with 3 approaches. A block grant to the school that could be used for basically buying more inputs, and 2 types of incentive payments. One was linked to the performance of the students. One of the performance incentives was to individual teachers. The other one was to the group of teachers. To give credibility to the whole effort, the assessments were of students were done independently by an NGO. There's already 2 rounds of data. They found positive effects on the 3 treatments. The incentives had significantly larger effect than the block grant. And while in the first year, the 2 types of incentives operated equally well, in the second year, the individual incentives operated better. The interesting thing is that politically, the program seems to be working well, and it's well liked by teachers. So there is similar stories to be told about the other areas. Again, with policy questions that are relevant, with efforts at trying to build the evidence that fails sometimes, and the vision that over time what we're doing is setting the basis for a process of continuous learning that is not going to probably give us thumbs up, thumbs down type of answers, but is going to inform us better as to what works and what doesn't work. A lot of this information can be found in our website, and essentially the spirit of what we're trying to do is again captured in this in Primo Levi's phrase that calls us to be more modest in terms of what we think we know, and to continue making efforts to verify and demonstrate what we do. Thank you.
Terrific. Thank you very much, Ariel.